I liked your thing about the changes to the NHS contracts with the practices. Some of them
It's a really good news story.
Sorry, lean back. So you got right this minute.
Great, Mr. Dubious.
No worries. Thank you. Cheers.
The question I always ask Yeah, credit. They were bidding to set up a national health report.
Okay.
Gentlemen, we're about to get underway. If you'd like to take a seat, please. Wait until the last few people can take a seat. There are some seats at the front if anyone would like to sit down. Okay. Well, my name is Judith Watson. I'm the chair of Tasmania Medicare Local, and I'd like to first of all extend my welcome to you all for coming today. It's a very important and exciting day for ourselves. I'd like to especially welcome Senator Lynn Thorpe, who has very kindly come to be involved and to say some words later on in the event. Tasmania Medicare Local acknowledges the Tasmanian Aboriginal people as the traditional owners of the land on which we are meeting today. We're here today to launch an exciting new initiative as part of the Tasmania Medicare Local After Hours program. The Tasmania Medicare Local is a non-government, not-for-profit organisation, importantly working to keep Tasmanians well and out of hospital. We aim to identify local health needs, work to address any service gaps and make it easier for Tasmanians to access services they need in a timely manner. This After Hours program is a great example of how we're living up to our mantra of connecting health to meet the local needs of our community. When we talk about after hours, what we actually mean is to provide care outside business hours, which predominantly is before 8 a.m. and after 6 p.m. during the week, and before 8 and after 12 on Saturdays, and any time on public holidays and Sundays. Since late 2011, the Tasmania Medicare Local has been working with health professionals and the community to ensure that after our service in this state are well planned, coordinated and appropriate for what we need. We've taken the community's advice on board in our planning to improve access to after hours care, and we acknowledge and value the significant work already occurring in the after hours care sphere across Tasmania. We have done considerable research, including community surveys, and we have also run an after hours citizens jury that has shown that many Tasmanians don't know what is available after hours in their local area and who they can call to get care. More than a third of Tasmanians who took part in our community survey told us they weren't even sure how to access after hours care for non-life-threatening conditions, and that there wasn't enough information available for them on the existing services. We also know from our research that many people call an ambulance or go to hospital for non-acute problems that should be dealt with outside hospital. As a result of this research, we undertook to develop a campaign to help Tasmanians work out when, why and how to access after-hours medical services. This campaign is just part of the work of the Medicare Local to improve the access to after-hours care for Tasmanians. And we will continue to build on this existing high-quality after-hours services and ensure that they are better supported, better promoted and better used by all. So once again, thank you very much for coming today, and I'd now like to hand over to Mr Phil Edmondson, who is the CEO of the Tasmania Medicare Local, to give you some further details of the campaign.
Thanks, Judith. Look, as Judith has said, the key question that arose out of our consultation with Tasmanians and across Tasmania around after-hours care access is, who do I call? So you'll see that question featured on all of the material, and it has formed, I guess, the fundamental component of our planning and the fundamental underpinning of the responses that we put in place. And we've adopted this particular theme as our campaign theme. The answer to the question is a threefold answer. The first and foremost, in acknowledgement of the fact that the substantive proportion of after-hours care provided to Tasmanians across the state is by their GP, that the first answer is your regular GP. They should always be the first port of call if you need urgent medical care and it's not life-threatening. Some GPs offer after-hours care to their patients. As a key message of the campaign, we need to be aware of what it is that your doctor does for you, and we want patients to be aware of what their doctor does for them. And those responses will vary from practice to practice and doctor to doctor. So make it your first port of call. If you don't have a regular GP or your regular GP is not available, you can still get medical advice 24 hours a day, 7 days a week by calling the 1800 022 222 number. This takes you to the free National Health Direct Australia helpline, where a registered nurse can provide information and advice if required. If need, they can also put you in touch with an on-call doctor in Tasmania in the after-hours period through the local GP Assist service. Tasmania Medicare Local has taken over the funding of that service as from midnight last night, and I can see Dr Davis at the back of the room there with red-tinged eyes, probably indicative of some of the challenges he might have had in the transfer period at that point. This is a unique service, and the collective voice of Tasmanians has been instrumental in getting the federal government to agree to fund this particular program and to continue to fund this particular program as it has been operating for the last 10 or so years. Other states are required to use a variant of their own sort of models and a combination of their own models in order to achieve the outcomes that they're required to achieve. We've been able to successfully retain the GP to GP support service in the after hours period, recognising the success of that service over many years. The third port of call in a life-threatening emergency is, of course, to use the 000 number, and we would always encourage that if people are either fearful of their health to the extent where it requires emergency response to that extent, to call the ambulance service on 000. A major feature of the awareness campaign is the new Tas After Hours website, www.tasafterhours.com. It's intended to be a one-stop shop for information about after-hours medical help, and progressively we'll be adding further depth to this in relation to further information about Tasmania's after-hours system. It includes a service directory linking to the National Health Service Directory, which allows people to search for their nearest general practice, community pharmacy, hospital or emergency department. And you can click the Show Services Open Now option on the website, and that will take you straight to services that are available. Our After Hours manager, Megan Mann-Leonard, will be demonstrating the website and its functionality shortly. We have invested considerable effort in putting together a mobile phone application, making it easy to link to medical advice on the run and providing that information at people's fingertips as and when they need it. This will be available later in July. Press advertising has started this weekend, and we've developed materials including posters, flyers, magnets, wallet cards, telephone stickers to try and get this message out there as widely and broadly as possible and as consistently as possible. These materials are being distributed in partnership with a range of health and community services and organisations, and we intend to try and get as broad a coverage as we can in as fast a time as we possibly can. The campaign was developed with input from a range of stakeholders, and we recognise that as the first part of a longer term process, a great deal more information will be added both to the website, and a great deal more activity will be done to ensure that our response in terms of broader service availability is as comprehensive as possible. We thank the providers and the organisations who've provided input to us over the last 12 or so months. They have greatly influenced the outcome of this particular process, and they greatly contributed to the value and the content that is currently provided. Because this is a starting point about who to call after hours, we need to recognise that the process of imbuing a new message within the forefront of individuals' minds out there in the community is a progressive and iterative one. And we encourage all of our partners and other providers to be talking the same message wherever possible, and we'll be working with those key providers in order to support them to do that. The important thing also is to recognise that this campaign has been influenced heavily by input from consumers, and ultimately it's the consumers who we are trying to get to, because they're the ones whose immediate needs drive them to certain points of response or certain points of action in the wee hours of a morning. So we recognise and acknowledge the fact that consumers have played a great part in ensuring the content of this site is relevant to their needs. We are working with other groups such as the Pharmacy Guild and other bodies, other professional service providers, to ensure that as the website develops, further service information about those particular points of call and points of support for community are added to the website as we are able. What I would now like to do is to invite the Senator Lynn Thorpe to provide us with some further details and to officially open, if you like, the campaign. So thank you very much, Senator Thorpe. We greatly appreciate the Senator's ability to make herself available to us at fairly short notice, I understand, over the weekend, so thank you.
Thanks very much. I too would like to acknowledge the traditional owners of the land on which we're gathered and pay my respects to their elders past and present. And most particularly I want to pass on the apologies of my colleague Julie Collins. So most people in the Labor Party over the last week, it's been quite tumultuous, but particularly so for her, and she's up in Canberra at the moment actually being sworn in as Minister for Community Services amongst other areas of responsibility. And I do know Julie quite well as a friend, and I know how much issues like this that we're dealing with today matter to her because of her care for community. And maybe some of us old enough in the room to be able to cast our minds back to the days where if you weren't feeling well in the morning and you woke up and you said to Mum, I don't feel well, to say go back to bed and I'll ring the doctor. And you'd spend the day in bed with flat lemonade and a Vegemite sandwich and getting totally spoilt. And then sometime in the afternoon your kindly GP would knock at the door and come in, but your parent, your mother or father, whoever, would be quite comforted by knowing that all they had to do was pick up the phone and have their concerns allayed, and that someone would turn up, probably take your temperature and say, look, just keep her in bed for a couple of days, or make sure she doesn't look at any bright lights, or make sure she doesn't scratch that particular rash. And everyone was quite comforted. But how things have changed in the intervening years. It's become quite a problem, I think, for many of us on two levels. One is the appropriate use of the very, very expensive medical services. I mean, as people involved in health, I'm sure you're all very aware that provision of health services is not cheap, and it's a big priority of our community going forward. So when someone uses services appropriately and efficiently, then that health dollar can go further and help the people it most needs to get to. The other side of the equation, of course, is the confidence that the community has in being able to access help when they need it. And this is particularly important for people who are, for whatever reasons, a bit isolated, whether it be by living out of town or being a young mum with young children without a car and needing to know where to go. So I applaud the effort of everyone involved in this fantastic campaign, because there will be many a young mum or an older person caring for a partner who will be very, very relieved to know that there's just one phone call they can make and they're doing the right thing. There are too many people who feel that all they can do is dial 000, and that is not a good use of our ambulance service, it's not a good use of our emergency departments. But if by receiving and having a short conversation with someone on the phone, they can know that someone is aware of what's going on, someone is sending them in the right direction and giving them the advice they need, then we're doing the right thing by our community. So again, congratulations, and now you just need to go out and sell it so all the people out there know exactly what to do. So my congratulations. Thank you.
Senator Thorpe, and I'm aware you do need to leave fairly shortly, so thank you very much for being present today on behalf of Julie Collins. So thank you. Hello everybody, I'm Megan Mann-Leonard. I'm the Manager of After Hours Care for Tasmania Medicare Local, and I'm very pleased and proud to actually be able to launch our After Hours Awareness campaign today. So my role today is to actually talk you through some of the marketing material that you've actually got in the resource pack with you at the moment, and also to showcase our website that goes live today as well. So with the materials, with my team, when we were actually sat down only 3 months ago to really look at what information we would actually need to be providing as part of our campaign to the community, we really needed to make sure that our message was very, very simple. And really, it took a lot of work to pare down the resources and our website to have a very simple message. Also, we needed to make sure not only was the message simple, but whatever we produced, it was loud and clear. So there is so much white noise within the health sector, and again, as Lynn and Phil referred to, people really don't know at times how to access after hours care, what the care is. So as we were developing up our resources and the information that resides currently on the website, we really needed to look at, well, what are the groups of people that we know based on our research potentially might be high users of after hours care, or aren't actually accessing care because they're not sure of what care is out there, who can they contact, and really what is appropriate access. So our research showed us 4 target groups that we have developed our campaign around, and we'll continue to develop further. So parents with young children were one of those groups, our Indigenous populations, older people, and also culturally and linguistically diverse populations here in Tasmania, we know are really our target populations at this stage. So within the materials, again, to reinforce what Phil's message was, with our feedback from stakeholders, it was very, very clear your first port of call is your own regular GP. If you don't have a regular GP, or your GP doesn't provide after hours care, what are the other options? So certainly with a lot of our collateral, you'll actually see that, you know, it invites the person to actually document and record their regular GP's contact details. So it's always readily on hand. Thank you. Now I'm going to show you...
When you need medical help, who do you call after hours? Your regular GP should always be your first point of call.
My apologies, we went a little bit too fast there, so apologies. So now what I'm going to do is actually show you the video that resides on our website. And really, as you go into our website, intuitively, you will want to click immediately on the video link. And that link will actually take you through your options, so it's providing you those key messages
Also, it then talks you through how you can then go and search online through the National Health Services Directory to find a current service that's actually available and open to you. And so, Tony, thank you.
When you need medical help, who do you call after hours? Your regular GP can still get medical advice 24/7 by calling 1800 022 222. Always be at your fingertips everywhere you go. It's never been easier to find the right medical help.
And just to end, so with the resources that you've got with you, if you want to look at the left-hand bottom corner, we've actually got an RQ code, so a quick reference code that if you've got your mobile app, if you've got an app that can download that code or can read that code, it will actually automatically take you to our TAS After Hours website. As Phil said, we do have a phone app that will be coming and being launched later this month as well. So we'll continue to communicate to the community about what resources are out there. Also, we'll be currently updating the website to also include a consumer survey as well, to really try to get feedback from our community about not only their experience in the after hours, but also their experience with navigating through our website as well. So look, thank you very much for your time today, and again thank you to my hard-working team that have made today a success, and we'll continue to develop and mature our After Hours campaign over the next several years. Thank you. I might just ask for any questions, if anybody would like to actually ask some questions. Phil, would you like to come up?
We encourage you all to go and have a bit of a look. Have a look at it, see how it works, and yeah, encourage your constituents, members, or clients, whatever you want to call them, to do the same. So thank you very much for your attendance today. Thank you.
It's on then, is it?
So you can broadcast in stereo.
Okay. Oh, this one's for them. This one's for ABC.
Oh, I see.
All right. Okay. Dr. Judith, would you be able to just tell us a little bit about this initiative that's been unveiled today?
Well, today the Tasmania Medicare Local is launching its After Hours Awareness campaign, which is a very important initiative for our organisation, and we hope that it will provide a lot of useful knowledge for the Tasmanian community to help them more aware of what their options are to seek care in the after hours period. Obviously, there are 3 different levels of care that you can access. The first one is to, first of all, discuss with your GP and know your GP's availability after hours. Many GPs do provide extensive and comprehensive after hour services. If that is not the case, then we are pleased to be able to use the National Call Centre service with the 1800 number, which provides you with access to a nurse who can help with many inquiries, and if they feel that the need is further...
That's all right.
If the nurse feels that the illness requires further information and more management by a doctor, then the call will be transferred directly to a Tasmanian GP, and a Tasmanian GP will talk to you about your problem and will recommend a course of action to take, which is great. And then that course of action may be to see your GP in the morning, it may be to go to hospital, it may be that you can be provided with a prescription for a simple problem, and that can be obtained and help you with your problem. And then, of course, if you have emergency problems, you must ring 000, and that's very important to remember. But it means the right care in the right place at the right time. And the more the community knows about what their options, the more chance they have of getting the services that they require in a timely manner.
And through the nature of after hours care, I suppose there can be a number of injuries or instances, accidents, whatever they may be, health issues just in general that can pop up and be very, very stressful for the public. Obviously you can't access a GP because it's after hours, and this is a really good step in the right direction to maybe put some minds at ease and make sure that the care and the treatment is there at all 24/7 really.
Well, that's right. At any time of the day or night there are opportunities to get advice, and the advice will be available soon. So once again, your GP may be able to provide that advice to you at any time, or it may be that the National Call Centre will provide the advice, and if you require further advice, then a Tasmanian GP will be able to be on the phone and help you with your problem. So it certainly gives a lot of surety to the community that they will get the care that they need.
What impact will this have on the emergency service like TML, for example? Obviously gets a lot of traffic that perhaps is unnecessary for that service. How will that help?
Well, indeed, if you have the ability to access advice, then you may find you don't need to ring 000 unless it is an emergency. For non-urgent conditions, these options, the GP, the 1800 number, will definitely provide the advice that's required without needing to call 000, which, as you say, is an expensive and in some cases unnecessary way of managing your health problems.
And just within the home, how is this going to help help families, help just everyday people with their health concerns?
Well, I mean, I think the situation many people remember is when they had small children and the child became ill after the GP had closed, and there was always the question of where can you seek advice. So if your child is unwell or has a fever or an ear infection, you will be able to seek the necessary treatment that is required using these various options.
Fantastic. Thank you. All right. Ready?
I'm rolling.
You're rolling?
Yep.
Yep. All right. Okay. All right, Phil. Forgive the two microphones.
You're right, that's fine.
It's like one waving in a claim. Mate, obviously great for your organisation this morning to reveal this and announce it, but obviously even greater for Tasmanian families.
Yeah, look, it's fantastic to be able to respond to what the community has been telling us about their often inability to understand who to go to for what piece of advice. This provides a nice, clear and simple stepped approach, GP, after hours call line, and then only in the event of an emergency the 000 number. So it's good to be able to respond to the needs of the community in that respect and provide them with clear direction about where to go for the advice that they need in the out of hours period.
What's the process that you guys have gone through in getting this up and running and having it as an alternative channel, I guess, to something like 000?
Sure. Look, it's been an extensive period of consultation. We've engaged with community, healthcare providers, emergency service providers and others to ascertain the best approach to take in ensuring that communities understand and need, get the messages they need. So this has enabled us to really target our message appropriately and possibly, taking account of what it is that existing service providers already provide and ensuring that those gaps in knowledge and understanding are filled.
And I was just speaking of, obviously, 000. You have a number of people that call up 000, sometimes for the wrong reasons, because they don't necessarily have anywhere else to turn to and they're quite minor health problems. You guys can now really fill that void. Do you think that this will, in partnership, help 000, help that as a better resource and be better more efficient, should I say?
Well, certainly our challenge is going to be making sure that the community is aware of and gets the message we're trying to get to them. So an important part of this campaign will be ensuring its reach is broad and wide, because that will actually ensure that Tasmanians have the right numbers at hand and ensure the right response to take for the situation. But certainly overuse of emergency services numbers has been a growing problem, not only in Tasmania but nationally over many years. So it'll be very interesting to see whether or not this campaign, and we certainly hope it does, can certainly change or stem some of that flow of calls in an inappropriate direction.
And just one last one for the families at home and just the general public at home. How is this going to obviously improve their health and improve their ability to care for themselves and care for their family and loved ones?
Well, we certainly hope that that families are not left to their own devices. I mean, it's important for families to realise that there are people out there who can help them and who can help alleviate their problems and understand their needs in the small hours of the morning. And we certainly understand as parents, many of us, that it's often a case of really desperately trying to find an answer to a question that sometimes is very simple. So we certainly hope that this will help to ensure that people have access to that appropriate channel to utilise.
Thank you, mate.
Cheers. Thank you.
You're all good?
Keep rolling.
Okay, well, obviously this is great that an initiative like this has been announced for you as a parent, because I imagine when it comes to caring for your son, you really need that information 24/7, not just 9 to 5, 9 to 6.
That's right, yes. It's the middle of the night when you've got a child with a temperature that you can't comfort, that you need that reassurance that something's available. You can just pick up the phone and speak to a registered nurse. And having 3 children it's hard sometimes to leave the house as well, so just having that backup on the phone is what you need, reassurance.
And when it comes to something that may be just a simple little health issue that you need some clarification on, it's obviously, you know, not worth getting in the car and driving down to an after-hours clinic or something like that, forking out hundreds of dollars. This is going to be great now to be able to phone up and just get that clarification, that peace of mind that, you know, your child is safe and you're treating him in the right way.
That's right. Sometimes as a parent, you're a bit unsure as to how serious the situation is, and just to have that free call number where you can talk it through, get the reassurance of whether you need to take it further, or you can just happy to watch them with some pain relief yourself. So that would be fantastic, yes.
So obviously you yourself would use a hotline like this, and I imagine you have a number of friends and other members of your family that will be very keen to pick up the phone call at any time they need, pick up the phone at any time they need it.
That's right, yes. Lots of friends and family would definitely utilise it. And the upcoming app that will be available on mobile phones as well will be a benefit, that you can access it anywhere. So we'll be definitely downloading that when it's available.
And what do you reckon, Oliver? Are you pretty happy with it, mate? Yeah? Oh, good. No worries. All right, thanks, guys.
Thank you.
Thanks. Nice to meet you as well.
Yeah, nice to meet you
There we
too.
go. It's pretty pain-free.
Yeah, it
wasn't
was.
We're rolling.
Okay, Karen, can you tell me how many children do you have?
Sorry, stop there.
Okay.
Okay, and rolling.
Karen, how many children do you have and how old are they?
I've got 3 children. Oliver's the youngest and he's 4, and his brother Austin is 6, and Isabella is 10.
And have you ever had cause to wonder who do I call in the middle of the night or after hours?
Yes, definitely. It's usually the middle of the night or a Friday night when the children start to come down with something, and so you wonder, yes, middle of the night, who do you call, what's available, where can you go, sitting up with a sick child that has a temperature, and yeah, it's not the best feeling not knowing where to turn.
So what are the circumstances usually? You wake up to someone crying in the night?
Yes, temperatures are usually the main thing, ear infections and things like that that just come on to little children so quickly. Have had a situation where my middle child had a head injury, and it was just, you didn't know whether it was bad enough to call an ambulance, whether I had to go and see a GP. So just those kind of situations where you've got that number that you can ring straight away to help guide you as to where to go.
And what have you done in the past when this sort of thing has happened?
We've usually rung 000 just because that's the most known thing, and it's if the GP is unavailable, obviously. Obviously the first point of call would be your GP if it was business hours.
And how do you think that this campaign will help parents like yourself with young children?
Just to have that peace of mind that 24/7 you've got someone on the other end of a phone, a registered nurse, or if needed a doctor that you can talk to, just to guide you through, advise you what to do, whether it can wait till morning or whether you need to take further action, just to have that reassurance.
So as a result of this campaign that was launched today, what do you think you'll do, or how will it change your life?
I'm definitely looking forward to downloading the app that will be available soon, to have that instant access with me all the time, and be saving the website to our favourites menu so that we can look up if we need pharmacy assistance at 10 o'clock, we can look up and know where the after-hours pharmacies are. And there's also a fridge magnet that we'll be making sure we keep on our fridge, just to have those steps, what to do, who to call.
Fantastic. Right, I think that was all I
Got it.
was wanting to cover. Thank